So our study was on various topics covering fetishes and BDSM. My name is Rachel Bailey.
I'm Casey.
Marissa Mercer.
I'm Candace.
I'm Carissa.
Okay, so I'm going to go over the general numbers for our participants. We had 673 complete the survey. We took out 280 of those participants because they were incomplete or they were non-applicable with the data set, so they weren't old enough or they didn't consent. For the age range, we had our participants were through 18 to 60 years old with an average of 26.38. For gender, we had 171 indicate being male and 174 indicate being female, with 48 saying other. We also asked about relationship status. We had 165 participants say that they were single, 61 were married, 67 were committed and living together, 80 were committed but not living together, 4 were divorced, and 16 indicated other. For race, we had 282 say that they were white or Caucasian, 5 said they were Black or African American, 33 said Asian or Pacific Islander, 20 indicated Hispanic and Latino origin, 3 said Native American or Indian, and 50 said other. So for our demographics and procedures, we asked a few basic demographic questions, which included what is your age, what is your sex assigned at birth, what is your gender, what is your ethnicity, and then what is your relationship status. For procedures, we posted a recruitment ad to Reddit, and when they clicked on that link, they were to answer consent, age, and demographic questions, and then they filled out our various surveys, which included the measurement of sex fantasies, the self-dis, undeserving self-image, 2 types of fetishism, and unwanted childhood sexual experiences. So for my study, I looked at childhood sexual assault and BDSM practitioners and the possible overlap between both of them. So for the BDSM etiology, there was a previous study that found the BDSM practitioners had higher levels of self-reported childhood sexual assault. In that study, they found 8% of men and 23% of women indicated this, and the general population at the time of the study was 3% of men and 8% of women. They did indicate in the study that the women's numbers were a little skewed because of the participant pool. One of the possible reasons for this connection is a thing called sex guilt. This is a generalized expectancy for self-mediated punishment for violating or for anticipating violating standards of proper sexual conduct. Higher levels of sex guilt can develop into fantasies of force through that study by Brown et al. Did. And there's also the possible pipeline of PTSD being in a possible manifesto of BDSM, because trauma can result in sexual behaviors as a way to like soothe or recapitulate the trauma, in a way to like redo the trauma to make it not traumatic. So for childhood sexual assault, 6 to 62% of women and 3 to 31% of men report being sexually assaulted before the age of 18. The range on this number is due to how you define sexual abuse and how you define childhood. And then the 2 most common behavioral issues that have been shown to come as a consequence of childhood sexual assault is substance abuse and prostitution. So for my hypothesis, I wanted to look at the results from the unwanted childhood sexual experiences, which had an alpha of 0.88, and then the Wilson Sexual Fantasy Questionnaire, which had an alpha of 0.83. And I ran those through a t-test for independent groups. And I found that participants who indicated prior history of childhood sexual assault and current BDSM fantasies were not statistically different from those who had no history of childhood sexual assault and BDSM fantasies. So for my exploratory analysis, I looked at the correlation between gender and childhood sexual assault. And with that one, I found that there was a weak significant positive correlation. And then I also looked at gender and BDSM fantasies and found that those were also weak, non-significant negative correlation. So for implications, limitations, and applicability, for the implications, a possible future study could broaden to look at trauma in general when it comes to the development of BDSM fantasies, because it might not be that just the childhood sexual assault is responsible, but it could just be a traumatic thing in general. With this particular study, there were a couple of limitations. The age of the participants was pretty low for the average. And then the ethnicity of the participants was very misrepresentative of the real world. For future research, if future research contradicts, then research indicates that BDSM is a possible form of exposure therapy to cope with prior traumatic experiences. So if there is a link between the two, then treatment can be tweaked to better help the people with these traumas. There's also, if it is congruent, then it will squash some of the stigma that trauma victims have with being considered broken or whatnot when it comes to like having these BDSM fantasies, because it's very stigmatized still, even with the new liberation of it. So in conclusion, for my study, the goal was to explore the etiology of BDSM fantasies and their possible link to childhood sexual assault. And while my hypothesis of its connection was not supported, this still gives researchers information to work off of. The more data gathered and manipulated in order to look at this connection only allows for a deeper understanding.
So my hypothesis for my study was that there would be a positive correlation between interest in fetishism, BDSM, and positive attitudes towards these practices. So Ventriglio et al. In 2019 defined fetishism as sexual attraction to things that are not inherently sexual. So this could be shoes, clothing, body parts, or any other object. Fetishes are outlined in the DSM under paraphilias, which are conditions characterized by what's considered to be abnormal sexual desire. Scrolly et al. Defined BDSM as a variety of sexual practices involving bondage, discipline, dominance, submission, sadism, and masochism. Masochism and sadism are also outlined under paraphilias in the DSM. For fetishism, masochism, or sadism to be considered a disorder, they must cause disruption and distress in a person's life. However, the association with disorders and abnormality have led to stigmatization of both practices. So I looked over previous literature in an attempt to find the prevalence of fetish and BDSM practices. A study in Belgium found 46.8% of participants had performed at least one BDSM or fetish-specific activity. A similar study in Quebec found 45.6% of people desired at least one paraphilic behavior. 44.5% of this was fetishism. And Scrolly et al. Found a majority of fetishistic interests were involving body parts and objects associated with the body, such as shoes or clothing. So even though these studies are not generalizable to the whole world, we can see that there's some prevalence of fetishism in BDSM. So as I mentioned, there's a lot of stigmatization that comes with practicing fetishism and BDSM. Harrison and Murphy found participants who identified as having a fetish perceived them to be misrepresented and misunderstood. Colosi and Lister found people who practice fetishism were well aware of the stigma associated with it. They wanted to emphasize that their interest in fetishism was not a choice and that it should not be confused with pedophilia. I found a similar trend with BDSM. One study found people who practiced it associated the disclosure of their practice with shame, which is why many of them only disclose in safe places like kink websites such as FetLife. A study by Stockwell, Walker, and Eschliman found people who don't practice BDSM were more likely to rate it, as well as fetish terms, as sick rather than healthy, as opposed to what we would consider normal sexual practices. Because of this stigmatization, I predicted people who don't practice fetishism and BDSM would have more negative attitudes toward it. To measure people's interest or fantasy about fetishes and BDSM, I used the Wilson measurement of sex fantasy, developed in 1988. This measurement is used to analyze sexual desire and behavior. I used 2 of the 4 subscales, one being impersonal, and that has 10 items. Sample items include intercourse with an anonymous stranger and being excited by material or clothing. And then the second subscale I used also has 10 items. Sample items include being forced to do something and whipping or spanking someone. And item scores ranged between 0 and 6, with 0 being never and 6 being regularly. To measure how positively or negatively people felt about fetishism and BDSM, I used the same subscales, but did some rewording to measure attitudes. So I used the same sample items from each subscale, but asked participants to rate how positively or negatively they felt towards each item. So my results did show a strong positive correlation between interest in both fetishism and BDSM and positive attitudes towards both of these practices. The correlation was stronger for the sadomasochistic scale, and I think this could possibly be because of the visibility BDSM has captured in recent years. So my study did have some limitations. The Wilson measurement of sex fantasy was originally scored 0 to 50, and I scored 0 to 60. A majority of our participants were white or Caucasian, which is not very representative. And then I also would have liked to identify whether participants identified as having a fetish or practicing BDSM. So future research could develop a more in-depth scale to measure positive or negative attitudes towards fetishism and BDSM. I think the items could be worded a little better and could be more specific to these behaviors than the Wilson measurement of sex fantasy is. Future research could also expand by asking participants whether they actually engage in fetishism or BDSM. So this research is beneficial for understanding how positive or negative people feel towards both of these practices. And we can compare this with past research to gauge how attitudes have changed over time. Our further understanding of attitudes towards fetishism and BDSM can also be used to advocate for the destigmatization of these practices. So conclusively, we did find a significant relationship between interest in fetishism, BDSM, and attitudes toward these practices.
All right, and then my study was based on adverse family history and fetishistic fantasies. So for a little bit of a introduction history review, fetishism was brought into the psychological sense in the 19th century. DeBrosses defined it as worshiping objects, and then another definition by Aronson is intense sexually arousing fantasies, sexual urges or behaviors involving the use of non-living objects. And then Ellen, 1988, excuse me, defined it in 3 scholarly traditions, but for the purpose of this project, the psychological tradition says that in which part or an associated artifact replaces the whole as an object of usually sexual desire, the result of repression or disavowal. So I hypothesized that there will be a positive correlation between people who have had adverse childhood experiences and those who participate in fetishistic behaviors. And then for the sex fantasy questionnaire, which was done by Wilson in 1988, there were 20 items, each measuring frequency of fantasizing. It scored from never being zero to regularly being 5, and there was a range of total possible scores of 30 to 150. And then I also used the adverse childhood experiences questionnaire by Fern, Sato, and Cuban. There were 9 items measuring potential deficiencies of family environment, and it was a simple yes or no response. For descriptive statistics, the adverse childhood history questionnaire, there was a total mean score of 11 to 17, mean being 13.88, and standard deviation being 1.03. And I found the Cronbach's alpha to be 0.20. And then the sexual fantasy questionnaire, there was a total mean score of 20 to 115, with a mean of 51.20 and a standard deviation of 14.52. And I found that Cronbach's alpha to be 0.83. So I did hypothesize a positive correlation, but after testing, there only came out to be a moderate correlation of the two. And I did want to mention the reliability for the sexual fantasy questionnaire. It was 0.83, and then the family history questionnaire was a bit lower, being 0.20. The limitations of my study, the family history questionnaire that I used was very brief and not very descriptive. It only had 9 questions, each of them being a yes or no answer. So I feel like in the future, if this were to be done again, it could be strengthened by using more questions, each reaching a bit more in depth. And then overall, our participant majority, a lot of our participants identified as white, and that was not very representative. Discussion, stigmas of individuals, excuse me, stigmas of individuals who choose to participate in fetishistic behavior could or should be lessened after seeing these results. And this also opens the door to understanding and or implicating further research as to why individuals choose to participate in certain fetishistic behaviors.
So I did sadomasochism, theories of undeserving self-image. Sadism is a term first devised by Kraft Ebing to associate violence, cruelty, and lust with each other. Masochism is a term derived from the name Leopold von Sacher-Masoch, an Austrian who explained the satisfaction he gained from being subjected and beaten. A survey conducted by Hunt in 1974 said that 4.8% of males and 2.1% of females reported receiving sexual pleasure from inflicting pain. 2.5% of males and 4.6% of females receive sexual pleasure from experiencing pain. Self-dis is the self-defeating interpersonal style scale, and it is a measure of the tolerance people have for mistreatment in relationships. It comes with 3 factors: insecure attachment, low self-worth, and the resulting rationalization of negative outcomes, and sacrificing one's own needs, such as safety. My hypothesis was that there will be a positive correlation between the participants with self-defeating interpersonal styles and the relationship with sadism and masochism. I used both the Wilson Sex Fantasy Scale, which had a Cronbach's alpha of 0.83, and the self-dis, self-defeating interpersonal style, section B, which had a Cronbach's alpha of 0.93. Overall, it's a 200 question questionnaire, and it's divided into 3 subscales: insecure attachment, undeserving self-image, and self-sacrificing nature. I only used 19 items on the undeserving self-image subscale. And for the Wilson Sex Fantasy Scale, we used 20 items measuring sexual fantasies. 10 of those items were on the sadomasochistic scale. Its items range from 0, never, to 5, regularly. The self-dis items scored from 1, strongly disagree, to 5, strongly agree. After performing an independent samples t-test, the men's attitudes towards themselves and their self-defeating styles was not statistically significant in comparison to women's attitudes and their self-defeating styles, with men's being a mean of 50.61 and a standard deviation of 10.09, and women's being a mean of 54.30 and a standard deviation of 10.51. Men reported engaging in sadomasochistic activities more than women, leading to a significant difference between men and women's sexual engagement, with men reporting a mean of 51.61 and a standard deviation of 16.04, and women reporting a mean of 50.06 and a standard deviation of 13.01. The findings show a statistically significant difference in the engagement of sadomasochism and self-defeating interpersonal styles. However, there were a few limitations, including the data did not represent the entire population, because it was majority Caucasian and a younger generation. The present study gave some insight into the self-esteem aspect of individuals with interest in paraphilia, more specifically sadism and masochism. The findings show that the correlations between self-defeating personalities and sadomasochism was statistically significant.
So that concludes our studies, and here are our references.